There are so many different types of pills out there. Pain pills, vitamins, blood pressure medicine, depression medication. The list goes on and on. There's a good chance that you probably take a few of those. But have you thought about what they could possibly be doing to your organs? Dr. Rudy Gari from Florida Pain Relief Group is back to shed some light on this. Dr. Gari, great to have you here, and this is a really important topic.
Yeah, absolutely it is. And so one of the problems with pain pills is that if you think about it, when you take a pill through your mouth, it has to travel first to your stomach. It gets absorbed. From there, it goes to your liver. 90+% gets broken down, and then it gets spread from head to toe.
Okay, so what if you're taking multiple medications and they're all going into your liver? What's that doing to your organs?
Well, that can have a significant effect in your organs, especially, so let's talk about some of the pain pills. A lot of the pain pills have acetaminophen. Acetaminophen is a very good analgesic, but it wasn't meant to be taken in very high dosages. So it's metabolized by the liver, and we know that taking too much acetaminophen can affect your liver. So that's a big problem with taking pills. We see a lot of that when patients come in. One of the things that we do is we want to give them their medications, but we want the medication to be absorbed right directly to where the problem is.
Yeah.
So we like to use some different ointments and creams. For example, if you have low back pain, we may apply some of that right exactly into the back or to the joint to get absorbed through the skin. You don't have to take this pill that gets to your stomach, liver, and it goes head to toe, and only a small fraction gets to the problem area.
Yeah, if you can bypass those organs and keep them as clean as possible, then.
So like a perfect example, let's just take morphine, which is a medication. I can inject a tiny fraction of morphine, let's say, into your back, maybe 1/10 of a milligram, half a milligram. That's actually a lot more powerful than if you take 100 milligrams of morphine by mouth.
Wow, I don't know why everybody wouldn't say that's the better method.
And what happens is when you take a very small portion and you put it to the area that's painful, that's the only place that it goes. When you have to take, for 100 milligrams to get to equal like 1, you have to take a lot of it, and it goes from head to toe, liver, all of your organs get affected that don't really need to be affected by that medication.
When we see ads on TV, we see pills being advertised, and they are a cure-all for everything. It's not, right?
Well, unfortunately, no, it's not. We all want to take a pill and have it go away, but a lot of times what's exciting now is that we target exactly where that problem area is and go right to it and use the smallest amount of medication necessary to get that taken care of.
How can medication affect you mentally as well as physically?
Well, what happens, if you think about it, our bodies and ourselves can become dependent. So if you had to take a pill, it almost becomes a reflex.
Right.
We don't want you to get into that habit of having to take pills all the time. So if let's say like a patch, we can place a patch on you that's good for 7 days. We can and some ointments, some creams that you don't have to worry about taking a pill 4 times a day. So people get very dependent on that.
And we've all heard of people dying because of it too, because of overdosing.
And the problem is when you take it, sometimes we don't know exactly how it's going to work. We do a lot of different things like pharmacogenomics to determine your metabolism of that, but still, even with that, there's side effects.
Okay. Dr. Gari, important stuff here. Thank you very much. Visit their website. It is floridapainreliefgroup.com to schedule your same-day appointment, or you can give them a call. It is 844-KICK-PAIN. We'll be right back with more Daytime, so don't go away.